Good morning and welcome, you guys. My name is Lena Ferdizi. I'm the Student Services Specialist Senior for the Student Leadership Center here at Glendale Community College. It is my honor to welcome you today to Glendale Community College's Native American Heritage Month celebrations. It is my pleasure to introduce today's speaker, Valaura Imus-Nahsonhoya. Thank you. Ms. Imus-Nahsonhoya comes to us from the Hopi tribe. She is the Arizona Missing and Murdered Indigenous People Coordinator for the Governor's Office. She is the founder and executive director of and I'm going to butcher these, I am really sorry. Hanwansi Consulting Services, previous director of community engagement for ASU's research on violent victimization, the associate with the National Criminal Justice Training Center for Fox Valley Technical College, and study coordinator for Arizona State Missing and Murdered Indigenous Peoples Task Force. She earned her Bachelor's of Science in Health Promotion from Northern Arizona University, and a master's in criminal justice with an emphasis in legal studies from Grand Canyon University. With over 20 years of progressive experience augmented by a strong background in victim service program development and implementation, including policy development, grant proposal writing, and financial management, effective in coordination and collaboration of major events, and subject matter educator and training on victim services implementation, human trafficking, domestic violence, sexual violence, missing and murdered Indigenous people, and other related topic. Her partnerships expand through the United States, Canada, and Alaska to assist with improvements of advocacy, health, and wellness of Indigenous people. Ms. Imus-Nahsonhoya will be discussing the missing and murdered Indigenous crisis in Arizona. And following her presentation, we have a film screening of Highway of Tears, which sheds light on the 724-kilometer stretch of highway in northern British Columbia. Please join me in welcoming Ms. Valaura Imus-Nahsonhoya to the podium. And I'm sorry for butchering.
Good afternoon. Thank you for having me. And also welcome to our online viewers. Wish you could be here with us today. As you know, we also would like your questions if you have any. But before I present, I want to just do a little bit background. First of all, are we all staff or are we all students? Staff, have enough. Both. Okay, that's great. I assume our online viewers are probably mostly students. So thank you, Lena, for the introduction. That was my professional introduction. But I'm just me. I've been doing my work for a very long time, mostly in Indigenous communities. But also the collaborations that we have. I want to share a little bit about why I do my work. Not only am I a survivor of domestic violence, sexual violence, child molestation, it took me a long time to actually share those words. I could not speak of that until the death of my perpetrator. And many of us experience some of these justifications for ourselves. A lot of my work is really geared toward my victims and survivors. Their well-being and being able to acknowledge their victimization is really my priority because it is part of our healing. So to say that today, I want to thank you for listening to that because it is part of my healing as well. It just adds another movement and step toward my healing. And every time I say that, I get this really hot feeling in my body. So it's still a trigger for me, but I acknowledge that it is part of healing. Also, I worked at the federal level, and I was denying many of our clients, our victims, really because of the programmatic guidelines, the requirements of taking survivors in to be able to provide services. It really bothered me in my heart, and I decided I can't really do this anymore because I felt I was not giving the proper services. So I created Hunwensi. Hunwensi, I chose, that is my Hopi birth name and also my womanhood name. And I really hold that dearly. In Hopi, our Bear Clan is our higher leadership, and that's who I was born to. And it means standing bear woman. And I really see myself as that individual and to honor not only the Bear Clan and the family that took me in, but really to be this person who is going to stand strong for my survivors and my families. With anything that I do, that's how I view it. And also, with the work that we do, we're very boots on the ground. We have a missing persons trafficking recovery program. We actually have been taking individuals out of lately sober living homes who were identified as missing people. And also, we want to collaborate with law enforcement in some of our processes because that's not what's happening most often. So, this is just a background of where I am, why I do this work, and where, now going into the presentation of where we are currently, and again, some of the whys. I don't mind you asking questions. If we have any questions online, don't hesitate to ask me. I really am very personable. I don't like this to be too formal, but I really just want to get some of this information out as for your knowledge as well. In April of this year, I was appointed to by Governor Hobbs to be the Missing and Murdered Indigenous Persons or Peoples MMIP coordinator. I wanted this job for a while. When it came, I did hesitate a little bit because I wanted to know if she and her office were also on the same mind path as I was in working in this group or this population. So it took probably a few days for me to really learn about them, to really understand what her priorities are, to understand where she is working and wanting to work with our Indigenous population. So she definitely met my needs in terms of me accepting the position, and here I am. So today I want to do some historical overviews, and then understanding where we are here in Arizona, and then also sharing a little bit about where we are with our task force. So this is my presentation today. I appreciate you guys will be watching Trail of Tears because this is where the work actually began. This is where we identified a lot of the violence and the victimization that was happening to our Indigenous people. It was Canada. I had to give credit to Canada in the work that they've done around this issue. It was grassroots women who began this movement. It's really important to honor them, to recognize that. I met these grassroots women in several places in my career, read their reports, and listened to many of their presentations. What was really not surprising to me, but critical, and what I retained in their work is there's a highway that you guys, how do you do this? I forget. I don't remember. But there's a highway that comes from Ontario up through the lakes here. There's several reservations through there to where, and this is not this is a fact. They were identifying remains along this highway. The significance of this remains is they were women women remains that were found along this highway that were buried. They didn't know where it was coming from. It took a while for them to actually state that they were indigenous women from Canada crossing over, or vice versa, from these tribes in the northern region. The other identifying factor when it came to Canada and the United States, many of you guys probably heard about the oil fields incidents that were occurring with our indigenous people going into these man camps. They were also indigenous individuals from Canada, but also mostly from our northern states that were involved in these man camps. And what was happening was they were utilizing them as trafficking victims. They were being sold. I was unfortunate to have actually visited that place. I wanted to go, and I wasn't able to at the time. But the videos, the pictures that the agents brought back to our office, I was able to look at them, and it really showed, and the impact it had on me was that these women basically, obviously, were slaves. They were doing the cooking, they were doing the cleaning, but also after hours, they were being sex slaves. A lot of this language that we use is sometimes hard for us to say, but in this work, it took me a while to even say sex or anything about what was happening with our indigenous people, because I always felt that that was a private word for intimate couples. But in the work, this is what we try to share with our survivors. It's okay to say and to share your experiences. Again, it is about healing, right? So these were the two significant factors that I found within, not just my work, but where we are as indigenous people. So with the ad hoc, as the state coordinator in our research, we partner with ASU Research on Violent Victimization Lab, and we also partnered with the Croy and Milligan. A lot of our reports are now online. If you don't have access, I certainly can email that to Lena, and she can share it with everybody. I'm very proud to say that Arizona is but is the only state that has done so much work around validating stories of our survivors and our families that are affected by missing and murdered, or any kind of violence, domestic violence, sexual assault, human trafficking. And I say this very, what's the word I'm looking for? Confidently, because I've spoken to 15 states who have task forces, or who have ad hocs, or who have any kind of groups that are addressing missing and murdered. And all of them are at the beginning stages. So here in Arizona, we have 5 actual research findings. We're continuing to do more work as a result of that. But I want to share with you some significant findings and why we started doing this work. How many of you guys heard about the Urban Indian Health Institute, the research that they did, right? So this was the very beginning. I was not yet I was actually doing my consulting work at this time, but I was asked to write bills. I never wrote bills at all. I'm not a politician. I don't know anything about it. But our former representative, Winona Benali, called and said, "Val, we need your help. We need you to be able to testify." I said, "Sure, I can do that. I can share some of our experiences." Well, had to learn about it, right? So the reason why she was very adamant about doing something about this issue was because she found out that the Urban Indian Health Institute did this study, and she shared this with me. And what it was, and what was very concerning to her, as you see here, Tucson was the number 4 state in Arizona, or nationally, right, that had a higher number of individuals that were experiencing missing and murdered. Secondly, Arizona was number 3. This data came from Tucson law enforcement data. It didn't include our Phoenix Metro or any other jurisdictions. This is only Tucson. So when we looked into it further, I met Abby Echohawk. We had several teleconferences. We met twice here in Phoenix. And we were trying to figure out what can we do as a state, what can we do, to really learn about this issue. It was a collaborative effort. But I wanted to know where they came up with these numbers, how they came up with the data on this. Unfortunately, this data was from Tucson law enforcement jurisdiction. She identified that it wasn't quite accurate because they weren't identifying specific Native American in this data. It was a guesstimate, right, of indigenous people. So we continue to do more work in this. So this was really the groundbreaking for us here in Arizona in terms of us moving forward with learning a little bit more. So as we know, data is limited. Some of the work that ASU has done is that in the research, ASU did more of a national overview, state overview, tribal overview of what was happening in these communities. But at that time, in July of 2020, we did find 12 indigenous females that were recorded as missing in Arizona that ranged from 20 to 54. That's a low number, right? From the number that we've been hearing, that we've been recognizing of individuals sharing some of their stories, but the documentation of these numbers was inaccurate. Along with, we recognize that many of our individuals that were missing was documented to be twice as long as the average age for males at 12 years, but our women at 21 years of age were identified as missing. These numbers were very confusing to us. It was like, what does this really mean? Those were always my questions, but our researchers also we can't even prove what these numbers actually mean, right? So these were some of the findings that we did see, but also that, we have many reports that are going around nationally that are very specific to communities, but none of our data are comparable. Also, within our murder cases, here in Arizona, obviously we have the higher population of indigenous people here. And I always say that Arizona, we have 22 tribes. I believe that we have the highest population living on tribal land, but I also believe that we have one of the highest, I think we're number 3 in the nation that has the highest population of urban Native Americans who actually live in urban cities. But within our murdered data, we have 74% of homicides of our indigenous women and girls who were handled by municipal police. Now, what does that mean again? These were the number of cases that they had in these precincts, but also within our sheriff's office and our tribal police. Although the numbers, again, and the data that's shown here, we're certainly not seeing the accurate numbers. But also our indigenous females of all ages were murdered in Arizona, ranged from infant to elder, with an average victim age of 31. That data was collected from these cases here. So, these are some of the things, again, that we did learn about our homicide cases, but we necessarily could not prove, were they missing first, then murdered? Because adult missing persons is not a crime, right? So we could not identify that. Who's doing this? Most of our offenders were Native American. We have a big debate with this with some of our federal folks. They say that it's our non-Native who are perpetrating, but I certainly can share with you that when I was with BIA as a victim specialist working with our crime victims, over 90% of my perpetrators were Native American. So these are some of the things that, I like to share personally. Those were some of my experiences. But, when we think about our non-native populations that are also offending against our indigenous people, currently we have this sober living crisis, right? Our sober living crisis, we've identified the highest to be our populations were international individuals that were hosting sober living homes and illegally running sober living programs. So, we've had a significant increase of individuals that were legally missing, meaning that parents and families reported their loved one to be missing. Prior to the state knowing and understanding what really happened, our missing persons program did recognize some kind of a change in what was happening, but we definitely couldn't identify what was really going on with these individuals that were missing, especially from our families. But now we do, and I'll share that with you shortly. Again, our data, the weapons used, most oftentimes were guns. Next were knives, and then personal weapons, unknown weapons. One of the things that survivors shared was most oftentimes they were strangled first, right? When they say strangled, they describe that as I was choked. Well, there's a big difference between choke and strangulation. When you're choking, you have something caught in your trachea. I think it's trachea. I don't know my anatomy. So that's choking, right? We have something in here that we're choking on, but when we're strangulized, we're cutting off the air that goes, for us to breathe. So anytime that somebody says somebody choked me, that's strangulation, right? So we really had to identify the differences with our survivors to really understand what was going on. But even if we did that, we still had the number of their weapon of choice for the perpetrator to be a gun. Now, these stories, I can share you an example. To really identify an indigenous person who was missing, and we're learning and we continue to learn from our survivors, I would say a majority of them would say that they met somebody, they willingly left with them off reservation because of the enticement of alcohol and substance use. Majority of the time. I'm not saying all the time. I'm saying majority of the time. They come to, example, Phoenix, right? They're having a good time. They're having a time of their life. Because I kid you not, many of us have not experienced this type of life coming from reservation. Many of us are living on the reservation, doing what we do out there, but sometimes our furthest place we go is, for me, I'm Hopi, so I'm imagining like Winslow, Flagstaff, but we only go there to shop, right? We don't do a lot of socialization. Our purpose is to get there, get our groceries, do what we need to, and get right back home. Well, now we have the enticement, and these are some of our trafficking stories as well. When we're enticed with, come with me to Phoenix, I'll buy you a bag. Well, I can get a bag anywhere I can. Well, many of us are not too familiar with designer bags, right? But when they began to learn about it, and wow, I never had that, like I really want that, and well, I'll buy it for you, come on. So they come. Well, now they purchase this designer bag for them. Now the perpetrator claims them, well, now you owe me. So this is how that enticement comes in. This is how that power and control comes in. This is how the victim is not able to let loose of and leave this person who has control over them. And we've heard from missing individuals that survived that most oftentimes it was the show of the gun. We know guns are powerful. We know it can take that one shot that could kill us, injure us, so definitely there was a lot of threat happening to these girls. The relationships, our number one were our intimate partners. And where this could come in is that we can be with our intimate partners, and I'm telling you, I'm sharing some scenarios with you in terms of what some of our survivors share with us. But they have an intimate and began an intimate relationship with an individual, again, going off land. But we have multiple incidents also occurring. We could have not only violence, but we could also have trafficking. They may get here to the valley and sell the individual to another trafficker. They may get here in the valley and sell them for themselves, whether it's for sex, whether it's to do labor trafficking. We've identified individuals who were actually trafficking guns and ammunition here. So, these are just some things, but it was always somebody that they knew for the most part. We did have some children that were also part of this process, and children I can't handle. Honestly, I can't handle. It was really always sad for me every time that I learned of a child. But, these children are definitely affected, especially our teen population. But our young babies are also being trafficked. Believe it or not, we had a 4-month-old that was being sex trafficked. So it is happening. It is happening, and that's something that we have to know and understand, that they don't care who we are, what age we are. It could be any ethnicity, just as long as you can provide that product and you can bring in that income. That's all they care about. In one of our researches that we did, this happened during COVID, and our intent with our ad hoc was go to each 22 tribes, learn from our family as survivors that were affected by missing and murder. And we couldn't do that. We had to go through IRB, we had to go through MOU. Many of our tribes were totally shut down, nobody in the office, but we had to continue. And we were able to only interview about 37 of our indigenous population. And what this shows and what we learned from these individuals is that we had 6 families that shared incidents of their loved one that was murdered, 5 survivors that shared their stories, and family members that shared 10 of their loved ones' stories that were missing and murdered. And then we also had 6 true survivors that were missing and shared their stories. Males, I won't go through the numbers, but as you see, it's a little bit less than our females, but we also had the opportunity, and we did allow to interview our male and our transgender, because as you remember, this study was only around women and girls, but I could not just not listen to them. I needed to listen when they were willing to talk, so I allowed that, and then we were able to learn from them as well. Our transgender population, they shared stories when they were missing, and this was they were both also sex trafficked in their experiences. During this time as well, what we did learn was that 160 indigenous women and girls were known to be murdered between this time period. Although many of the data here in Arizona is not as much as we want it to be, because we just have a lack of data communication or entry into our systems. And we talked about our infants and elders. So this was one of our studies. We certainly utilize a lot of this research to be able to identify not only their experiences, but how do we enhance some of these responses to their experiences? And that's where we are right now with this information. This is the time frame of our study. We did this back in 2020. LaCroix and Milligan Associates was the one who did the what we called our field interviews. We not only listened to our family and survivors, but we also listened to law enforcement. We wanted to find a comparison of what were these families and survivors sharing, and what were our law enforcement sharing to hopefully come to meet in terms of what our responses are, but that's not how it was, right? We had a short time frame. For me, it's really critical to share this because during my interview time, I had like a little over 30 days, maybe 45 days. I can't remember right now. But my interviews lasted anywhere from 30 minutes to 6 hours. I just could not let them not talk, and I just allowed them to share whatever they wanted to. But I also allowed time to debrief because they were sharing so much of their experiences. You know, we cried, we laughed, we went through all these emotions. And many of it was triggering not only to them, but it was triggering to me. So we also had to go through a debriefing. We use professional counselors to debrief us. So, you know, those are very important for me before I even got them off the phone. These are statements here that I wanted to share with you that were very significant to me and to our ad hoc in terms of what were our families and our survivors telling us, right? Unfortunately, the number one was to take their cases seriously. And what this means is not only from a law enforcement perspective, but that is the number one. Please take my report that my loved one is missing. And that was not happening. The law enforcement response to this was, we did not take those reports because it's not a crime, right? So these were some of the reasons behind it. Some jurisdictions did take a report, but it was only notice of information type of a report rather than an actual formal report. So when we do the formal report, they enter into NCIC, they enter into all these federal databases. So in an event, you know, if they find a person, they pull them up and they can be identified as person. But we also learn here in Arizona that an individual that is reported missing, they still were not getting entered. For some reason, they were getting cut off. We had incidents where even we were involved in, we found an individual that was missing, told law enforcement that they were reported missing. Well, there was no report of that person missing. We had another case where an individual was missing from Arizona, was found in Las Vegas, and it was every time that they found her, there was no report. Every minute, mom was calling, I'm reporting my daughter missing. Why is this not out there? You know, so we've had those stories. We have those incidents to be able to tell us what is actually happening. So we want to start fixing some of these areas that are ineffective. We have this jurisdictional maze. Even with our sober living incidents, we might have an individual that was, for example, in Hopi. They left on their own, so that's not a crime, right? But if they were enticed with alcohol and substances, or even forced or coerced, that, you know what, we're going to go to Phoenix, we're going to drink all that we can, I'm going to give you a good life. You know, is that coercion? It can be, right? So they come to the valley, they do all of this living, they're using, they're doing all of this stuff. Well, some of our jurisdictional incidents, that individuals that we found missing, individuals that were found deceased in these sober living homes, who has criminal jurisdiction? We're still fighting that. We're still fighting that with our judicial system to be able to identify some of these jurisdictional questions that we have. And it's very frustrating to the family because they want to continue to pursue criminally, but then again, it's up to that victim, up to that survivor if they want to move forward. That's another challenge because they don't want to go through the experience again. So these are just some of our voices of our survivors and our families that express to us, you know, what what they felt that was really important to them. But number 3 is the most simple thing. What? Being empathetic, being compassionate, and being communicative with all agencies. Like, how can you not do that? That's always been my question. But I certainly can understand from a law enforcement, like they're super busy, but that should not give an excuse that they cannot provide some of those emotions to their survivors as well, or to their victims. Some of our challenges, we talked about law enforcement, our databases are not communicating from tribal to state to federal, so we don't have accurate number, right? Law enforcement agencies, certain ones are only accessible to certain databases, or you have to purchase license to be able to get into some of these databases. So the challenges are certainly there. Many of our tribal communities don't understand human trafficking. They don't understand, how can an individual be trafficked, because we only think of sex trafficking. The other thing is that we have a lack of patrol and officers investigation in Indian communities. Our investigative resources are very limited. Many of us don't have that cultural sensitivity to be able to work with indigenous population. Most and foremost, missing persons is not a crime. Adult missing person is not a crime. So we have all of these systemic barriers, but in history, and since I've been working with this for some quite time, we've made some improvements in some of our responses. For example, since this research that we've done in 2020 up until now, 2 things that I can share with you is that we added the simple box of Native American and a line to say what tribe that this victim is from or this survivor is from. Many of our police municipalities here in Phoenix Metro didn't have that simple box. And how we learned about that is we went to the ME's office and said, how are you identifying our indigenous people? This is what we get from our law enforcement. When we identify them here, they have a tribal tattoo or anything like a feather, and we can identify them as Native. Anybody can get a feather tattoo, right? You don't have to be Native, but that's what was happening. And we were able to make some adjustments or strengthen some of that response as well. So today I pulled this up from NAMIS. How many of you know about NAMIS? NAMIS is the National Missing and Unidentified Persons System. This is available to anybody in the public. Anybody can get onto this system. Anybody can report a loved one missing on this system. So today we have over 23,000 missing person cases. This is just our indigenous population nationwide. So you can certainly find this on their website. It changes daily, I tell you not. That you have to really keep up to this if you really want to learn and understand what's happening. If you sign up for this, it'll give you additional information in terms of what you're also looking for. For example, this map here, it'll provide you, this is only for our missing persons here in Arizona, and this is just for today. It certainly has increased since the last time I gave this presentation about a week or 2 ago. The red are individual cases located within these land bases. The blue, they have multiple cases, so you have to click on it, and then you'll be able to see additional incidents that are occurring within this land base. When I looked at the territory of the whole nation this morning, we're probably number 1 or number 2 in comparison to other states with the most dots in our state. This one is our missing persons from Arizona, not our missing persons, our homicides, or remains found here in Arizona. So, you can also, there's unidentified remains that you can search for. There are missing persons, and then our homicides that were identified on tribal land. Then this one's just on tribal land. So what I want to share as well is that the impact that this is all having on our, not only our indigenous population, but because we're here in urban communities, it's affecting many of us here in terms of also the resources that they might be asking for. Many of us are impacted in many ways when it comes to victimization, when it comes to violence, or any other experiences. But I like to think of this as, we're experiencing so much from historical trauma, from our historical experience when it comes to maybe genocide. We are living those within ourselves, right? Many of us are, because our families have also experienced so much in their lifetimes. But we're holding on to a lot of this pain. We're holding on to a lot of these experiences that's causing us to climb this little pyramid, that it leads to some of our deaths. It's a lot of worry, a lot of things that we experience within our lifetime. We have to, as we age, we're growing with a lot of these things, right? And we're experiencing more so, and when we recognize some of these experiences when it comes to our emotional, physical, psychological, social, medical, is sometimes it's too late. We develop the diseases, we develop these disabilities, and then that's what we're focused on in our current life. But as we begin to pull the layers of our trauma and going through our own healing, I always say that if I have an opportunity to change my own family dynamics, because I know what my family went through historically, I know what their victimizations are, I have an opportunity with my daughter who doesn't have a child yet to be able to end that burden for her child, that she doesn't necessarily carry a lot of that trauma for her child, but we can begin to heal my daughter from her experiences, right? So the child will carry some of our burdens, but not as to a high intensity as my child who was also victimized. So this is where we can end it and minimize it. And as this child has children, we're limiting some of those effects as well for that child. So, these are some things that we have to think about. Us, you students here, don't have children yet, right? Some of you maybe, but we want to be able to somehow find it within ourselves to end some of our historical traumas so our children don't have to carry a lot of that burden that we have. Okay. So when we come to collaboration, not only through the work that we do through governor's office, the work that we do as grassroots, we always put the survivor and families first. We always put them in the center. Then we bring in everybody else, right? In terms of how are we going to support this survivor in this family to be able to address some of their, not just their trauma, but their experiences when it comes to systemic barriers. But we have significant things happening at the federal level with Non-Invisible Act and Savannah's Act. And our state levels, we have our task forces and our working groups. At our tribal levels, we have our direct services, we have our cultural and traditional healing and practices. So we all have an influence on one individual who is experiencing all of this trauma, and if we can come together, as state, as federal, as cities, as counties, Glendale, community colleges falls within all of those places, right, for their students who might be having experiences. So our governor's task force, we were able to graciously, with Governor Katie Hobb, she signed an executive order that we continued this work around MMIP. We were MMIWG first, and we moved it to P to ensure that we include everybody. So, this is the day of our signing. Very honored to be present. I was not yet coordinator at this time, but I was certainly working closely with all these individuals since the inception of the ad hoc. So this is a very historical picture for us in terms of that signing. So our task force was established in March of this year, and then we were able to publicly announce it on May 5th, which is MMIP Awareness. We certainly have the Awareness Day at the Capitol every year, so certainly come join. If you'd like to volunteer, you can contact us as well. We are now a 15-member task force. And many of our task force members are indigenous. They are from their communities. They are tribal leaders. We do have also individuals who are attorneys, who can be able to work on this issue. But we certainly looked at members who were also cultural sensitive and trauma informed in their own experiences, whether it was with their work or some of the work that they maybe done boots on the ground. But in this task force, I like to say we're a working task force. Our ad hoc was a listening ad hoc, where we heard stories, where we went into the communities and heard from our communities. But here at the task force, we're doing the work. I'm not doing the work, I'm coordinating the work, but my task force members are actually doing work. And when I say doing work, within our executive orders, we created 4 working groups: our health, our judicial, our policy, and our tribal working groups. We did assign them task orders in terms of from the executive order. Our judicial has 3, as you see, the red highlighted are some things that are significant to what they're going to be working on. So, these are just some areas that I share with you in terms of what our working groups are working on. In order to get here, they created goals and objectives of how they're going to be doing some of this work. And, many of them are, again, elected leaders. Many of them are full-time workers. And, the challenge is time. How are they going to have time? Well, we certainly support that. We certainly acknowledge that, but they made a commitment to this task force to do this work as well, and we hold them accountable to that. I hold myself accountable to it as well in terms of how do I guide my task force members to be able to accomplish some of this. This is an example of some of their processes. The red is one of the executive orders. The goals, that's what they've written to be their goal and their objectives. And certainly they have created some recommendations. But yesterday, their draft report was due. So we certainly have some recommendations we are going to be giving to the governor. We do have a report due December 1st. So we're now formatting that all together to put into a report for governor. But these task force members are also working with our policy advisors. We have an idea for a recommendation. We don't know if it's going to be a bill or if it's going to be an administrative or policy change. So we're getting that advice from our policy advisors to be able to help guide us as well. We do meet every 6 weeks. We've met several times this year. Our last meeting of the year is December 7th, and it may be a public meeting. I'm not sure yet, but most of our meetings are closed meetings because we definitely talk intimately about our family and survivors and some of their experiences. Our working groups meet 1 to 4 times between the 6 weeks because they have to report out what they're doing at each meeting. We have 4 reports due. Our final comprehensive report due is in 2026, but from now until then, we're just doing progress reports. So it's not a full comprehensive report. One of the things that I stick to is that in my work and the guidance that I do is to certainly follow Governor Hobbs, and in this particular statement is that we do want to turn meaningful reforms with pathways to justice for our missing and murdered. So this is constantly on my mind. This is constantly something that I think about, and how am I going to work today to be able to get there? So, this is our an overview, certainly, of what we've been doing. But do we have any questions? This is also at the end of the presentation. Uh-huh. Sure.
Thank you. Hi. I see again and again you talk about there's many barriers, but the barrier of it not being a crime to be an adult missing person. So I'm really interested in how you're thinking to improve that part of it. Is it language that people need to know when they call the police? Is it, so I'm wondering what you're thinking about that.
I'll give you a sneak peek. So one of the things that I think about, and I hope that we can introduce it, is that I feel like we have the capacity and the ability to be able to change a lot of language coming from this task force. But one of the things that I need to really back up and think about and look into is what are our families and survivors sharing with us in terms of, because we hear stories. My loved one was, had SMI. I'm trying to work with the attorneys. When an individual knowingly accepts substance use, but they're under the influence of alcohol and substances to the degree that they don't comprehend, does that make them vulnerable, right? According to legal language, like I have to look at those words, and with that, are we able to propose possibly a bill or an administrative policy to law enforcement to state if a family member says that their individual had SMI, or they are enticed by alcohol or substances, or they do use alcohol and substances to the degree that they don't understand or comprehend fully, right? If we can meet those elements, that's a great bill. That's how my mind thinks. I have to ensure that I'm following what is already in place, but manipulating that a little bit to be able to comprehensive address what our challenge and our barrier is. That makes sense. I get excited about it. Any questions? Other questions? Go ahead.
So you touched on this a little bit in terms of collaboration between agencies. When someone is reported missing, who should it be reported to? The tribal police? Should it be like a federal department? And I guess another follow-up question is, are tribal police, I guess, supported enough, and do they have enough resources for them to be able to, I guess, take on the cases themselves? So there's not so much jurisdictional issues.
The reporting agency is the agency from where the individual became missing, right? However, because this issue is so complex, our law enforcement jurisdictions have really enhanced their collaborations with our tribal communities. And that's a result of our survey, of our research. We were able to prove that that was not happening, right? So currently, many of our law enforcement jurisdictions are now communicating with our tribal jurisdictions. When I say that, an example of that is we have an individual missing from Navajo, right? But we know and the family know that they're in Phoenix. Well, Navajo can send down and enter them into NCIC, but they can also send down that missing persons flyer and give an alert to Phoenix. What's not yet happening though, Phoenix might not send it to, maybe the loved one was seen at Glendale, right? They're not sending that to Glendale. So we still have that gap of communication and collaboration, right? But who's doing this? It's grassroots. It's people in the community who are posting their loved ones. Facebook is our great law enforcement jurisdiction. This is where we find some of our individuals as well. But and we don't have all the resources that's needed. Again, the trust that our individuals have with law enforcement is not as minimal as it used to be. I think trust building is happening, but the majority of the trust is with our grassroots, not companies, but groups who are looking for individuals in the streets, right? So, these are some instances in terms of, how we're trying to improve that collaboration and communication and ensure that our tribes are speaking with our municipalities, because the majority of population that are Arizona indigenous people are going to is in here, Phoenix and New Mexico. So these are some of that data tracking, again, that at least for us in my company, that's what we're tracking, but it's not official because I'm not a government agency. I'm grassroots working with these families, right? But at least we have something to share. Yeah. Any other questions? Anything online? No? Okay. Well, thank you for having me again. Certainly, I have some cards if you'd like to reach me directly. And thank you.